The COVID-19 pandemic is the biggest crisis the world has faced in over a century. Millions of people have lost their lives and billions have been impacted by the pandemic. India was just recuperating from the damage done by the first wave of COVID-19, when the second, deadlier wave took the nation by storm in April 2021.
This second wave took people by surprise. Our healthcare system was not ready to cope with such a large caseload. Preventable deaths are happening because people are not getting oxygen on time, not getting hospital beds on time.
Hospitals and medical institutions were in desperate need of basic medical supplies. A shortage of those was leading to a surge in preventable deaths.
From 30 to 40 cylinders usage, jumbo cylinders per day, our demand went up to 170 cylinders per day. We perceive a need for an oxygen plant during this time.
We were lucky for the equipments like ventilator. We had only 4 ventilators, but because of this ventilator, we lost many lives.
We really felt helpless because the numbers were very large and it was difficult to cope up, or almost impossible to cope up.
The global ADRA network realized the need and stepped in to provide life-saving medical equipment to hospitals across India.
We have the tremendous opportunity to coordinate with an entire hospital system throughout India.
Over the next few months, ADRA reached out to hospitals with oxygen concentrators, ventilators, BiPAP machines, PPE kits, oxygen pulse meters, flow meters, and ICU beds.
I would like to thank ADRA India for giving us this 5 concentrators where we would be able to use them when we have COVID patients, especially because the last 1.5 months or so where we had patients but we could not take patients because we did not have enough oxygen.
I remember purchasing PPEs, one PPE set for 1400 rupees. That could be used only for 8 hours, after which it had to be discarded. It was at that time that ADRA sent us PPEs, which I can't explain how big a difference it made to us,
Sometimes we have to travel for 4 hours for the oxygen filling of the cylinders to Chandigarh. After 4 hours, we have to utilize those service of the cylinders. But now that deficiency is reduced.
During the second wave of COVID-19, I was affected with COVID as I was suffering with a high-grade fever and I had breathlessness because I'm an asthmatic patient. So our doctor denied to send me to the government setup for the treatment, as during the COVID first wave we did not had any equipment, no concentrators were there, but during the second wave we had got our own concentrators.
ADRA also supported the government in setting up a COVID care unit in Tinsukia, Assam.
We are happy we have been able to donate equipment and staffing where needed.
Among ADRA's major equipment contributions were 7 oxygen generation plants that have been provided to hospitals in Surat, Ranchi, Pune, Aizwal, Bangalore, Nuzvid, and Ottapalam.
I would like to specially thank ADRA for providing us one of the largest oxygen generation plants of the city. They went ahead, they looked at the different suppliers, they even found that within the country there was a huge scarcity of OGP plants. But they didn't stop there, but ADRA went a mile forward and looked for sources in other countries.
It's like a backbone, it's a strength that in case we run short of oxygen, we always have something to depend upon.
The medical equipment helped the hospitals in catering to the immediate health needs of COVID-19 patients. The equipment has proved to be beneficial not only during the pandemic, but will continue to serve the communities in the future.
Anyone who comes in the need of oxygen, we can help them. And it's not only for the COVID patient, it's also for the general patient, those who are having respiratory distress, okay, those are suffering from asthma.
सबसे ज़्यादा हमारा ऑक्सीजन कंसंट्रेटर यूज़ हो रहा है और इक्विपमेंट्स में हमारे ये पीपी किट यूज़ हो रही है और वहाँ कैप शू कैप वगैरह ये अभी भी बहुत यूज़ में आ रहा है मैम.
ADRA has actually given a life for many patients, those who were admitted in our hospital.
ADRA has helped us out to this hospital by giving us a very important oxygen generating plant. hopefully in future we'll be able to serve more people in a better way.
ADRA's medical aid was provided to hospitals in Himachal Pradesh, Uttar Pradesh, Assam, Meghalaya, Mizoram, Jharkhand, Andhra Pradesh, Kerala, Karnataka, Maharashtra, and Gujarat. Humanitarian outreach is ADRA's core mission, and the teams at ADRA India are grateful that they were able to provide needed aid and support during the COVID crisis.
Thank you for their all support. बाकी ये सपोर्ट हमेशा मिलती रहे तो इससे बेस्ट हमें और कुछ नहीं चाहिए जी.
No, we are thankful for that. Whatever we got support, that was very, very important and needed.